Hello, and thank you for joining us on another webinar session here at Senior Health Medicare. I have here today Nick Carter and Allie Giardini, and they are going to talk about attained age versus issue age for Medicare. So I'll turn it over to them. Nick, Allie?
Hi, everyone. Thanks for joining us. Again, my name is Nick Carter. I'm here with Allie. A little bit about ourselves. I've been in the industry for about 10 years, mainly focusing on Medicare insurance policies. Usually work over the phone and online, and licensed in most states with most companies.
And I am Allie Giardini. I grew up with Medicare in the family. I recently joined with my mom and my brother here at Senior Health Medicare, along with the other agents that we have in our office, taking care of everyone in this confusing time of their lives and helping them out, like Nick said, over the phone and on the internet.
Thanks, Allie. And like Courtney had mentioned, today we're going to talk about attained age versus issue age. And what these really are the two main types of pricing for Medicare supplement plans. So it's kind of how your rate increases are going to be mapped out. There is a lot of confusion out there about this type of pricing. And actually, a lot of it comes directly from Medicare.gov. The website, the way it explains these different plans, is a little bit misleading, and we'll get into that. But first, let's just define the different types of rate increases. I'm going to go over issue age rated policies. So technically speaking, the premium on an issue age policy is based on the age you are when you buy it or when it's issued, when you buy the Medicare supplement. Premiums are lower for younger buyers and have no scheduled rate increases as you get older. Premiums can still go up, though, because of inflation and other factors. So an example of that would be, let's say Mr. Smith is 65. He buys a Medigap policy and pays $145 a month, okay? Whereas his neighbor is 72, and she buys the same Medigap policy as him. Well, since she's older at the time she buys it, her premium is going to be higher. For example, like $175 per month. The thing about these plans that's attractive is that they have no scheduled rate increases. So the idea behind them is that even though you may pay more up front, in the long run, you'll save money. But stick around, we're going to get into the details of that. But first, let's go over the attained age policies. Allie?
Yeah, so the attained age policies have, they do have scheduled rate increases. The premium is based on the current age at which you buy it, but it also goes up each year slightly due to your age. So we typically find that these rates are going to be lower than the issue age. And they will go up, like I said, each year. But we typically see that increase only about 2 to 7%, depending on which company you get your supplement from. We find that most Plan Gs that we see with each company, they are usually attained age policies. So these policies may also go up because of inflation and other factors as well. An example of this one would be Mrs. Smith is 65 years old, and she has a monthly premium of $120. When she turns 66, her policy may go up to $126. When she turns 67, or at her anniversary policy anniversary date, I should say, her plan could be $132. So you see scheduled rate increases, but they're not crazy rate increases. You're not going to see a $20 increase just because of age. So that's something to keep in mind when you're looking for attained age versus the issue age policies.
Thanks, Allie. So when you listen to kind of the strict definition of these plans, a lot of potential clients will call in saying, you know, set me up with one of those issue age policies. I don't want to have rate increases. And that's where having an expert comes in handy, because there is a lot of misleading information out there. Whether your policy is an issue age rated plan or an attained age rated plan doesn't really matter that much as far as your future rate increases go. With Medicare supplement companies, no matter how they're set up with their rates, the biggest driver of rate increases is an industry term called loss ratio. And that just basically means, the pool of people that you're in, how much money they're bringing in premiums versus how much they're paying out in claims. And the higher that amount they're paying out in claims is, the more likely you are to get a rate increase. That is the single biggest driver of rate increases. Whether a company is issue age or attained age, they still have those increases factored in. So that's where buying an issue age plan really isn't that great compared to an attained age plan. In fact, what we found is that the way that the laws are set up with these companies and the rules that they have as far as rate increases go, the attained age, at least since plans modernized in 2010, has been a better value. And that's because this is a very competitive industry, and it helps when a company can adjust their rates ahead of time. So with an attained age policy, all these companies have experts and actuaries who are much smarter than I am. They can go and look at, what is the average claims for a 67-year-old male, for a 68-year-old male, all the way up the ladder. And they can forecast, and they'll tell the insurance company, okay, based on the claims in this area, this is the lowest rate you can charge. And these companies are going to charge as low a rate as possible. Whereas with an issue age policy, they can't really do that. So what we find is that the issue age insurance companies pad the rate to start out, so you're ending up paying more to begin with. And the reason is that down the road, if their claims and loss ratios go up and they want to adjust rates, they actually have to go before the state insurance board, open up their books, request an increase, and get approved. And that all takes time, and time is money. So in the long run, we've seen that the issue age policies have been kind of overpriced versus the attained age.
Yeah, the only thing I would add to that is we know these definitions are confusing for a lot of people. That's why it's really important. Give us a call. We can help you out and help you try and understand better rather than you just reading on the internet yourself. It can be a little bit confusing, so that is what we are here for. Do you have anything
Absolutely.
to add, Nick?
No. Were there any questions that came in?
Yes, we have a couple questions. So we'll start. Does issue or attained age apply for Medicare Advantage?
That's a good question.
No, it does not. Medicare Advantage plan it's a calendar year agreement. So your rate is locked in for that year. Every year during the annual election period, that insurance company can change that plan. They can change the rates. They can delete that plan. But you also have the chance to shop around during that time period and switch plans too.
Awesome. Okay, another one we have here is how can you find out what a company's loss ratio is?
Yeah, the best way to find out a loss ratio is give us a call. We have access to all that information, and we're more than happy to share it with you and kind of explain in more detail what the loss ratio is and how important it actually is when picking a company. It's one of the main things we like to look at, so it's important for you to do and to know. So give us a call and we can give you that information.
Okay, and then the last one was, do I have the option to choose attain or issue?
You do. I mean, as long as there's a company in your area that offers it, you can choose that plan. Issue age, most companies are going more towards attained age, so there's less out there that offer the issue age, mainly because the attained age helps them remain competitive. In fact, some of the companies that we write the last 2 years, because they're attained age and they're so flexible, they've actually had rate decreases, which is pretty much unheard of with an issue age policy. But you do have the choice if it's available.
Okay, excellent. That's all the questions we have. Thank you very much, Nick and Allie. And just really quick, we touched on a couple other topics during this webinar, and we have many more on the website. So choosing a Medicare supplement plan, underwriting, and all that kind of goes hand in hand. So be sure to check those sessions out as well. That's on our website at www.seniorhealthmedicare.com. You can also find our 1-800 number to get access to Allie or Nick and give us a call. So thank you for joining us and have a great day.